Hi everyone, thank you for logging on. We're going to take a few more minutes to allow others to join and then we'll get things started.
Greetings. It is indeed my pleasure to welcome you all to our 39th webinar in the Coffee with series hosted by the Greenleaf Center for Servant Leadership here at Seton Hall University. I'm Reggie Lewis, Executive Director of the Center, and it's great to greet all of you who've logged on today to take part in our conversation with the Nicholas Enrich, a servant leader whose mark on the world will be felt for generations to come. I'll give a more formal intro to Mr. Enrich in a minute, but first, a word about our webinar series and the center. The Coffee with series provides the chance to showcase the inspirational stories of servant leaders and the endless ways in which individuals, organizations, and society in general can be transformed by the power of servant leadership, a philosophy in which the leader first seeks to serve. For over 60 years, the Greenleaf Center has worked to promote the awareness, understanding, and practice of servant leadership. In addition to the Coffee with series, other core programs include the Greenleaf Scholars Program, which funds research on the efficacy and impact of servant leadership, a virtual course designed to provide professionals with the fundamentals of servant leadership practices useful within any sector. We also expose high school and college students to opportunities to develop lives of service through our Next Generation initiative. And through our outside engagements, we proudly work closely with organizational partners as they work to foster optimal growth in employees and nurture vibrant teams to achieve greater impact. Before a proper introduction of our guests, I'd be remiss in not acknowledging the generous sponsor of the Greenleaf Center's 2026 Coffee with Webinar series, the Terrell Fund. The Terrell Fund is a foundation that serves children and families in New Jersey and Vermont. The fund works collaboratively across sectors to make an impact in such areas as early childhood, K-12 education, arts, family support, and more. Thank you, thank you, thank you to all of our friends at the Terrell Fund. And now the moment we've all been waiting for. It's truly, truly an honor to welcome today's guest, Mr. Nicholas Enrich. Nicholas Enrich is the author of the New York Times best-selling book Into the Wood Chipper, a whistleblower's account of how the Trump administration shredded USAID. In this vivid account, Mr. Enrich provides a behind-the-scenes look at the organization as it was targeted for elimination. Mr. Enrich is a former civil servant who worked at USAID under 4 administrations. Mr. Enrich served as the Bureau of Global Health's Director of Policy, Programs, and Planning. I think that was called P3, right, Nick? Until January 2025, when he was designated as USAID's Acting Assistant Administrator for Global Health. On March 2nd, 2025, he was placed on administrative leave for exposing the Trump administration's illegitimate and dangerous dismantling of USAID and was removed from federal service later that year. Mr. Enrich's prior roles at USAID included leading the critical coordination structure in the Bureau for Management and for the tuberculosis program team lead in the Office of Infectious Diseases in the Bureau for Global Health. Prior to joining USAID, Nicholas served as a Presidential Management Fellow in the U.S. Department of Housing and Urban Development. Nicholas holds a JD from Brooklyn Law School and a BA from Tulane University. Nicholas, so great to have you. Do you have some coffee on your end, by the way?
Yes, I have my mug right here. Thank you. Thanks for the introduction.
Excellent. Great to see you. And let me remind our audience that you'll have an opportunity to raise questions with Nicholas, so you can actually begin to load questions into the Q&A feature, Q&A and chat feature, I believe. And my colleague Gabby will be facilitating that after my initial portion. But anyway, let's get started. Um, Nicholas, we have four categories that we'll chat with you about today, as you know, starting with formative years and that path to a career in foreign assistance. Sometimes we think of the formative years as the opportunity to tell the stories that maybe only your siblings know about. So, question one is, you hail from a very famous birthplace, Lexington, Massachusetts. Um, would you please share a bit about your childhood memories tied to the celebration of Patriots Day, something most people probably don't even know about?
Sure. Right. Grew up in Lexington, Massachusetts, or as we all fondly referred to it there, the birthplace of American liberty, because it was the start of the American Revolution, where there was a battle at the green of Lexington, the Lexington Concord. You know, I have to assume everyone is familiar with it because from a very young age, it was kind of drilled into our heads as we lived there. But as I've like grown up and moved away, I realized that not everybody learns as much about that. But the third April in every the third Monday in April each year is Patriots Day, which is at this point much more famous for it's the day of the running of the Boston Marathon, I believe. But in Lexington, there's a full reenactment where at 4 o'clock in the morning, Paul Revere rides into town, and then like a couple hours later, you'll get these 400 British redcoats coming and this group of Minutemen on the battlefield, and they'll have a battle. And as a kid, every year, my dad would wake me up at 4 o'clock in the morning, running through the house and shouting, "The British are coming! The British are coming!" And we'd all kind of like stumble out of bed and head down to the battle green and watch this reenactment. So it was a silly part of living in Lexington but I remember it fondly.
And did your dad have a particular hat on or something as he alerted you all that were needed?
That's right. That's right. The classic tricorn hat was the costume of choice. Yeah.
Excellent. Your book also has a wonderful account of your trek up Mount Kilimanjaro and your eventual decision to pursue a career in support of improving global health systems. Please tell our audience about what feels like, at least for me as I was reading it, this alignment of your aspirations to do something about, the misery you were seeing vis-a-vis global health systems and what President George Bush was literally doing at that time.
Right. So the reason that I sort of was steered towards global health as a career choice for myself was it was largely a study abroad program I did during college. In 2003, I went to Kenya to study development and health. And for those who are not familiar with trends in global health, 2003 was pretty much the height of the HIV epidemic in Kenya and many surrounding countries. And it was just absolutely devastating health systems and families and individuals. And, so it was something that I saw everywhere I went. And while I was there, coincidentally, in May of 2003, President at the time, President George W. Bush enacted the President's Emergency Plan for AIDS Relief, or PEPFAR, which has since become the largest and most impactful global health initiative on the planet, and has saved 26 million lives and just really changed the nature of the HIV epidemic. But for me, it was kind of an eye-opening moment where I was realizing that as I was kind of trying to see how I was gonna fit into this fight against HIV and to try to help make the world a healthier place, I felt like I was seeing my government make that same decision at the same time. And that really was impactful for me and kind of like helped steer me towards this career choice. Because at the time I was, we would go to hospitals or clinics or orphanages around Kenya, and I would often see the USAID logo. They were already there, and I felt proud. I felt proud to see it, proud of being an American, actually. That that we were providing these services, and I decided quite pretty much right then and there that one day I wanted to go work for USAID myself.
Outstanding. And hearing you say that reminds me of, I think, a quote you used in the book in which essentially President Obama was fond of saying, when people see USAID, they see America, they see the United States of America.
That's right. Yeah, I think the point being that maybe they see President Trump on TV and that's the first thing they say. But in terms of like what would tangibly mean something, the first thing they might see is that USAID logo on a health clinic, going to for a pregnancy visit, or on food support, that on those kind of like famous bags
Right.
of that with the USAID logo on it. And again, I think it's something that if Americans aren't proud of it, they should think about that, and I think they should be.
Absolutely. Let's move into our next category, into the wood chipper, USAID's demise. But before we get into the heart of this category, I think it's important if you would explain, because everybody doesn't know, what was the purpose of USAID and the scope of its work more broadly?
Yeah, so USAID was the branch of the federal government that administered foreign aid, non-military foreign aid, and and international development assistance. And we worked in over 100 countries and provided aid. I worked in global health, but in several other development sectors as well, including humanitarian assistance, education, food security, democracy and human rights, and a few others. And provided support on on extremely efficient basis. For example, our work, a recent study found, saved 92 million lives over the last 20 years alone. But I think it's important to note that USA was not a charity. It was a tool, a key strategic instrument of American foreign policy, and also part of the national security infrastructure to keep Americans safe. It kept us safe from the spread of infectious diseases, where we set up early warning systems to help ensure that countries could identify and respond to potential disease threats before they became international crises. But also, on the foundation of American goodwill, we built partnerships over decades in ways that created more stable trading environments and just increased security for a world where Americans stood to benefit and did over the course of the last 6 decades.
Absolutely. And I just want to highlight a number you just shared. So, over the course of decades during its existence, we're talking about an agency that prevented the deaths of, did you say 92 million people?
92 million just in the last 20 years.
It's amazing.
Yeah.
And yet there is, to my next question, seemingly this ongoing debate about the value of foreign aid and whether or not America should be investing a considerable amount of resources and money into helping other nations grappling with hunger, disease, and poverty. But give our audience an appreciation of the actual scale of, at least it does not exist anymore, but the scale of USAID's budget prior to the changes, and even how that budget laid out per capita from a per capita standpoint. Because there's this really bit of a misperception that, it's like the top three of our budgetary priorities, but
Yeah.
let me not give it all away.
Yeah, no, there's some like very interesting surveys that have been done on this, and when you ask uh, uh, Americans what percentage of the budget do they think go to foreign aid, they say the average is about 25%. And then you ask them, well, what percentage of the budget do you think should go to foreign aid? And they say, well, maybe that's a little high. It should be about 10%. But the reality is that foreign aid makes up less than 1% of the federal budget. And in global health, that translates to about $24 per year per taxpayer. And for the work that achieves this just incredible impact that has increased global life expectancy, that has removed millions of people from poverty, that has kept Americans safe from the spread of infectious diseases.
And then that last point you made in particular, since, pandemics don't recognize borders, right? So having an entity like USAID helping to prevent the spread of infectious diseases certainly benefits those nations, but it ultimately benefits us here in America.
That's right. And I think we're seeing that every day, including with the current Ebola outbreak in
Yeah.
the Democratic Republic of Congo. And we're seeing what happens when the early warning system that USAID had invested so heavily of taxpayer resources in building to keep Americans safe is ripped away. It ends up meaning that we're detecting diseases far later and that it's much more difficult and challenging to respond to those. And, I don't think Ebola is likely to be the next like global pandemic. It just doesn't, it's not like a virus that spreads in a way that makes it that kind of risk. But what I am concerned about is the way that our the ground that we've lost in terms of pandemic preparedness for what will
Right.
happen when the next pathogen that actually is the threat of a pandemic comes around. Will we be prepared to stop it?
Absolutely. Take us back now to that period of January through the first few months of the new administration in 2025. Um, Context for the audience, you and other Washington civil service had already experienced all the rumors regarding these imminent changes in the federal government workforce. So there was really no surprise about the reality that there was some form of significant change already in the works with respect to USAID and other federal agencies. But what was the new Trump administration's perception of USAID? How did this preordained thinking translate into this issuance of this executive order by President Trump requiring a 90-day pause on all foreign assistance conducted by USAID? And as I read it, particularly with the account of your book, it meant like stop cold, like no cease and desist from all activities. Um, what about all that, and why was this pause so detrimental to the work of USAID and the people served by the agency?
Yeah, good question. There's a few in there, so feel free to follow up. I'll try to cover as much as I can. But yeah, I think that the mindset coming in of the Trump administration and of the Department of Government Efficiency was very negative, to put it diplomatically, about USAID, and that was because they had very little information at all about what the agency did, and what they had received was coming from kind of conspiracy theory areas of social media, and so it was this perception that we shouldn't be helping people overseas when we have our own problems at home, with disregarding the fact that there is value for Americans of providing that support. There was the perception that all of our money was just wasted. It wasn't used to actually do anything useful. That it was being used to to promote like a abortion agenda overseas. I mean, it was. I've never seen a group of a new administration come in with so little accurate information about what an agency does, and then So I think that kind of set the stage for on day one when Trump issued his executive order freezing foreign assistance. When I first read that, the idea that he would want to take a fresh look at foreign assistance and make sure that it aligns with his foreign policy priorities, that seemed reasonable to me. But the way that it was worded, I thought it must be a mistake because it was actually saying that we would stop all the life-saving work that we were doing that moment. It would mean that like health clinics would shutter and patients would show up for their medicine the next day and not be able to get it. It would mean that we interrupted clinical trials that were testing new drugs and like potentially rendering them ineffective. It would mean canceling emergency ambulance services that were like the what would keep somebody during like a mother who was having a pregnancy crisis alive. But unfortunately, I found out very quickly that that was actually exactly what they meant to do. They
Right.
issued stop work orders to all the contractors that we had implementing these programs overseas, and the amazing work that USA was doing around the world came to a screeching halt. I'm not sure if that answers all of your question,
It
but let me.
does. It
Okay.
does. Just two quick follow-ups.
Sure.
One, they came in on day one with inaccurate information or lack of knowledge about what you all did as an organization, despite the fact that this wasn't the first Trump administration. This was Trump 2.0. And so you would think that there was be somebody who could come in and go, wait, no, wait a minute, they don't do abortions. They've never been about it's against the law. Like foreign assistance funds are not used to support abortions. But the other thing, Nicholas, is there was a communications ban issue. So you all weren't even able to like tell people, all your partners on the ground across these various nations, what was going on, which to me was just really cruel. If you could just
Yeah.
speak to that a bit.
Yeah. I mean, right. We were operating with all of our hands tied behind our back between the freeze of foreign assistance. And yes, as you mentioned, there was a communications ban that prevented us from even talking to the very partners that we were issuing stop work orders to them to explain to them what that meant. Like, we were getting questions like, okay, I see that we're not supposed to work, but there's somebody that we're supposed to be providing treatment to tomorrow. Like, what should we do? And we weren't allowed to respond to that. I mean, we were not allowed to talk to the World Health Organization. We were not allowed to talk to our sister agencies at the Centers for Disease Control or the Department of State. I mean, it was a total blackout on communications. And I do like to the first point that you made. There were a few people that came back from the first Trump administration, and actually, they were among the worst ones because they came back with an axe to grind.
Oh,
They
okay.
were looking for revenge, and these were the folks who, I mean, I'll just give you the example of the guy who became my boss, a guy named Mark Lloyd, who felt that he had been so mistreated during the first Trump administration at USAID that the career staff had leaked things about him to the press that he didn't think were fair, and they had like been threatening his family, and even at one point he said they killed his dog.
I
And
saw that. Yeah.
so,
I
I
read
mean,
that in your book. Yeah.
right. So,
Yeah.
I mean, I don't believe that USAID staff killed his dog. That doesn't sound like something that that group of compassionate individuals that I knew would do. But it gives you a sense of like what I was up against in terms of trying to earn the trust to restart critical programs from people who believed that we were pet murderers.
Right. Yeah. And critical is an understatement. These were life-saving programs. The other thing I wanted to ask you about during the course of this 90-day period was what felt, at least as I tried to understand the timeline of events in your book, there was like an intentional and very obvious hollowing out of these seasoned, longtime civil service and issue experts, um, including a category of folk called contractors. Share with our audience about like why that was important and impactful on USAID's overall ability to carry out its work.
Yeah, I mean, there was a lot of destructive actions that Doge and the Trump appointees took during the few weeks that I was there. The one thing just to clarify, there was this freeze of foreign aid that was put in place under the executive order, but like a few days later, there was a waiver that was issued to that allowed for the continuation or restarting of life-saving programs to while everything else would remain
That
frozen. And
was
to
the
me,
Secretary Rubio waiver, right?
that was Secretary Rubio who issued that, and that felt like a glimmer of hope to me because it suggested, maybe this is a moment of sanity, and while they're causing all kinds of problems with our with the work that we're doing, at least they're not going to like let a whole lot of people die while they look into this. And so I kind of saw that as my primary responsibility, was to implement that waiver, to restart the life-saving programs, which was challenging again because of things like the travel, the communications ban, and other issues that Doge was bringing on us. But at least that's what I wanted to try. And one of the things that Doge had done was terminate all of the experts within the agency. So, for example, I would raise, hey, there's one of the things that's a life-saving program that we need to restart is this malaria program. The rainy season is coming, and we haven't done any of the things that we usually do in preparation, like this indoor residual spraying. We distribute bed nets, we pre-position commodities, and if we don't do that before the rainy season, we're going to be set back years in our fight against, one of the top killers of children under 5. And some of the political appointees would say, "Oh, okay, yeah, why don't you restart that one?" But then I had to remind them that our entire malaria division, all the experts at USAID who understood the malaria program, had already been placed on administrative leave, could no longer access their email, and were unable to help us. So losing the expertise was a critical blow to our ability to implement our programs, and was one of the things that just kind of made us scramble. But it wasn't just that. Doge destroyed our payment system that would have allowed us to move funding to actually accomplish these programs. The political appointees would keep narrowing back what the definition of life saving meant to them, to the point that it was just absurd, and actually nothing would fit within it. And then ultimately, they terminated all the contracts that we would have relied on to get that work done. And that was the point when I realized that this waiver exists on paper only. And while they say that they're allowing us to restart life-saving programs, we're actually not. And people are dying here. And at the same time, we're hearing Elon Musk stand up at the White House and say that he restarted Ebola activities. And we're hearing Secretary Rubio say that this waiver is in place and nobody's going to die due to the changes to USAID. And I knew from being inside that it wasn't true. And I just felt like I could no longer stay silent about what was going on inside the agency.
And we're glad that you did not remain silent. For those who are not aware, who first used the reference to a wood chipper, and what was the stated rationale to justify getting rid of, USAID?
Yeah, so the wood chipper, that was Elon Musk. About 2 weeks into the Trump administration, in the middle of the night on a early Monday morning, he tweeted that he had just spent the weekend feeding USAID into the wood chipper. It's actually what I named my book after, because what I wanted to do was give readers a sense of what the chaos and destruction felt like from inside of that wood chipper that he created. I mean, it was probably one of the most honest things he had said, was that is a lot of really what it felt like, what was being, ripped apart, and the things that we had dedicated our careers to, and made these investments in, were just sort of ripped away. The justification, it depends who you ask. There's a lot of a lot of speculation about what the real reason was. I think that there were some that wanted to make an example of cutting a program that delivered support for people overseas. Musk himself bought into some of the conspiracy theories about USAID being a front for the CIA and other such nonsense. Others were concerned about it delivering abortions again, which is not something that it did. The rationale that Doge gave was that they were eliminating waste by destroying USAID and its programs, and that Marco Rubio would say that it was destroyed to better align foreign assistance with the president's policy priorities. But the reality was, is all of that, none of that was true. It was demolished by a group of uninformed and unqualified, tech bros who their sole purpose was to just soothe the ego of Elon Musk, and that was the reason that it was ultimately torn apart. Even though this was, a bipartisan, congressionally established agency that had, you know, achieved incredible results over the last 6 decades, and in a lot of ways was one of America's best ideas.
That's right. Again, that number you stated earlier, preventing the deaths of over 92 million people. But the chaos and the destruction was real. The consequences were felt. We have heard lots of numbers thrown around, but you've lived this. And so, to the best of your knowledge, what's a fair estimate, Nick, of the number of people who have died as a result of being denied assistance from USAID, as a result of USAID literally being fed into the wood chipper?
Yeah, the results have been absolutely devastating. Conservative estimates are that 750,000 people have already died just in the first year since USAID was eliminated, and over 500,000 of those are estimated to be children. And the scariest thing is that really the research shows that the worst is yet to come. I mean, it's people have perished as those programs were cut, and the rug was pulled out from under people who were depending on the promises that America had made. But moving forward, we have pulled the plug on the world's largest immunization campaign to inoculate millions of kids against the most deadly diseases for kids that are under 5. And we're seeing babies being born at clinics with HIV now at high rates, when just a year ago those rates were near zero because of the cuts. And so I'm really worried about what this means for the next generation, not just what the destruction that we kind of like saw in the immediate fallout. And yeah, in my mind, I mean, these numbers are so large and so difficult to grasp, but I do think that when the dust settles on the Trump administration and we're looking at what his legacy is, I don't think that he'll have had much of any policy decision he's made that has had as much of an impact as that choice to get rid of USAID and cut foreign aid the way that he did.
Very unfortunate. Second to the last category, Nick, is servant leadership under fire. And it's easy to live out and manifest these principles and practices of servant leadership where you put your people first, put your team first, when you're not in a crisis or under the kind of pressure you were under. As I read through your chapters, I kept, first of all, I was like, is it Jordana?
Jordana, yeah.
Jordana. I was like, she's the hero as well. We all should have a Jordana. In
That's my
addition
wife,
to,
by the way, for anyone who
yes.
hasn't yet read the book.
So, you know, outside of her, how did you hold up under this enormous pressure? So unbearable, the things that you have had to experience.
Yeah, yeah. I mean, it was a very scary time, and very unusual, actually unprecedented circumstances. And um, you know, I I didn't know how to respond or how I should respond. I tried to tell myself not to be intimidated, as you'll read in the book, that failed several times, but I tried to stick to it. I think one thing that really helped me was relying on my peers and my colleagues to bounce ideas off of and to kind of like keep each other afloat, as I was experiencing this. And then I think maybe the most important lesson that I was able to implement somewhere along the way. I probably didn't start that way, but that somewhere along the way I picked up is that there's no way to shield something like this from the teams that I was working with. And it dawned on me that people had different perceptions of like what reality was. Like maybe we'd be able to save our programs. Maybe USAID will, the courts will step in. Maybe Congress will step in. But the reality was USAID was being abolished, and I could see that from the conversations I was in. And at some point, I realized that I needed to be honest and open about that with my teams, and to trust them to understand what I understood. Sugarcoating it was not it was not fair to them, and it also was like my burden to bear of keeping bottled up what I was seeing happening. And so once I was able to share that with my teams, I think people had a better understanding, and we were able to kind of like deal with it together, and it resulted in the team coming together very strongly when the reality became clear to everyone that we were not going to be able to restart our programs, that I shared that our number one priority at this point is to bear witness to the destruction. And the team really came together and helped me build these memos to document everything we had tried to do to restart life-saving programs, how we had been stopped at every turn, and and maybe most importantly, identifying what the risks were going to be to the world without USAID's programs in place and what the impacts of that would be. And so, trusting them and sharing information openly and honestly, I think ended up helping to create those those very strong memos that ended up exposing what was happening inside USAID in a way that really was able to provide information to the world that they didn't have before.
Wow. Amazing. Um, so Nick, I'm getting a nudge from some younger staff people who say I'm hogging all the time with you.
Oh, sorry. Yeah.
But so last question is, you already alluded to, implications for the future. Is it possible to rebuild and reestablish a USAID and in light of the removal of, decades of institutional knowledge, how do we at some point, hopefully, we pray perhaps get some version of this back?
Yeah, it's a great question. And I think the sad answer is it'll be a lot harder to rebuild than it was to tear down. But I think it is important work and needs to happen. I do think that there are silver linings. There are opportunities that are created by the totality of the destruction of the agency because, you know, there were at there were ways to make our work much more efficient, and I think that we had challenges because of the bureaucratic structures that we faced, and it was hard to make those changes within a bureaucracy. And one thing that Doge did was tear down that bureaucracy so completely that do think that when we start to build back, we will be able to do things in a more efficient way. But I think the biggest challenge that remains is what do we do about the trust that we violated with the countries that we worked with? I mean, I think that
Yeah.
the foundation of successful development programming was this underlying commitment that we were going to be there. And I don't know how we're going to rebuild
Right.
that trust, and that's going to be a major challenge to the future of development.
Absolutely. Wow. Fascinating. Thank you, Nicholas. Don't go away. Gabby's coming on to facilitate our Q&A portion of the program. Gabby.
Thank you, Reggie, and thank you, Nick, for being here with us today. So, our first question is, at what point did you realize that remaining silent was no longer an option, and what factors influenced your decision to speak up?
Yeah, actually, the first time that I said no, I mean, like as you read this book, you'll see that I was really the question you're asking was something I struggle with throughout. When is it? How much should I be trying to improve things from within the government? At what
Mhm.
point is it no longer okay and I need to speak out? I was an advocate. I was not an advocate. I was not an activist. I was a federal employee, and my job had always
Mhm.
been that I implement policies even if I don't personally agree with them, because that's what the civil service does. We serve presidents of whatever persuasion, and so it was a hard decision to make. But I remember there was the first time I said no was when I was asked by I was asked to purchase a birthday cake and sing happy birthday to one of the worst political appointees who was gleefully in the process of tearing down the agency. And I remember
Wow.
saying I absolutely can't do that. And a colleague asked, like, well, why not? We've sang happy birthday for other political appointees when they're here, but and I just said, but they weren't trying to inflict this level of damage that's going to result in deaths of potentially millions of people around the
Hmm.
world. Like it's not normal. And so it's a small thing. It was like a birthday cake, but something clicked for me, and within 24 hours of that, I did gather my team together and tell them that we needed to switch gears, and our responsibility here was to bear witness and to document what was going on, and no longer to try to implement these policies that we were being ordered to, and so that it was in some way that was the impetus for me deciding that I needed to expose what was going on, even though I was sure at the time that it was going to cost me my job.
Yeah. It sounds like it was like such a confusing time, not knowing what the intentions were, like if you guys, like you said, could save it from the inside. But then that switch had to flip because there was no, it wasn't able to be saved.
That's right. That's right.
Mhm. Okay, so our next question is, as institutions across sectors face increasing polarization and public skepticism, what leadership practices do you believe are most important for rebuilding trust and fostering constructive dialogue?
Oh, that's a great question. I mean, I do think um, it's honesty, it's openness,
Mhm.
and I think that this is a problem that's happening. It wasn't just in USAID. This is um, the way that this administration has shown a pattern of kind of hollowing out federal agencies and departments of
Mhm.
the expertise that runs them and replacing it with sycophants that have no experience or understanding of the programs that they're taking over is creating this situation where across the government, civil servants are in this position of trying to decide at what point is it no longer okay? What point is this not normal anymore?
Mhm.
And I think it's making it's it's trying to decide what is what's personal agency, what does individual leadership look like, when do you stop working from within. And so I think it's to be honest with yourself. I think it's reminding, at least in the civil service, it's reminding the oath of office that we all took
Mhm.
to serve there, and then just deciding what does that oath mean to us. And someone has said that since I put out those memos and lost my job, that courage is contagious, and that when somebody stands up and does the right thing, it encourages other people to feel okay about, well, if maybe I can do that too. And so that was one of the things that I felt it important to write this book about, was to remind people that normal people make important choices every day, and that if you know if and when Americans find themselves in a similar situation, they can be changed, and they can stand up and say what when they see something's wrong. So I think that trying to set that example and trying to be honest with yourself and with your teams is critical.
Excellent. Yes. So, our next question is, how can the United States best prepare for possible future pandemics and related outbreaks under these current circumstances?
Yeah, like I said, I think we've seen what works. The the investment that the U.S. government made, primarily through USAID, in pandemic preparedness since the COVID pandemic
Mhm.
has been extremely successful in moving the needle in terms of um, the ability for countries to detect and respond to infectious disease outbreaks um, before they become international
Mhm.
crises. But I think that the maybe the biggest lesson that we'll need to get back to, and I think we will get back to hopefully before it's too late, is that these are not like individual country issues. These are global issues, and there needs to
Yeah.
be multilateral collaboration in order to stay on top of that. And that's what we set up. Honestly, this was not like the United States and Uganda and the United States and Vietnam like setting up individual ways for those countries to be prepared. It was done through the World Health Organization. It was done through a multilateral network of surveillance and information sharing that allowed countries in real time to see what was happening everywhere in the world, and that's what we've lost. And so it's a return to kind of a global and multilateral approach to
Mhm.
understanding how we can find and respond to infectious diseases, rather than what we're seeing now is the American response to, for example, the Ebola outbreak. The initial response has been, how can we prevent the disease from coming to the United States? Like travel bans. It's trying to build something in Kenya, for like a facility in Kenya, so that if Americans get exposed, they get sent there. And it's like breaking down the international collaboration that is necessary to respond to outbreaks like this, and for which the U.S. government used to be the leader
Mhm.
of that convening,
Yeah.
and we've completely abdicated that.
Yeah. And it's also getting back to that mindset throughout the country that it's not just us here. Like you said, it's the world that needs to that we need to think about, to all of us.
That's right.
So our last question here is, we are on a college campus at Seton Hall, and we are in graduation season. So as students prepare to enter the workforce, what advice would you give people who may find themselves in a similar situation to you, facing ethical dilemmas and challenges?
Oh, that's a great question. And congratulations to all the graduates. That's awesome.
Nick, including the one talking to you who just earned her master's in public administration.
Amazing.
Thank
Congratulations,
you. Thank
Gabby.
you.
So I think the advice that I would have is, we're at a moment where more and more Americans are feeling like something is fundamentally breaking in our democracy.
Hmm.
And we're all kind of faced with, what do we do about that, and what does that look like in our individual life. My story was about what when that happens inside the government, and I think that's a
Yeah.
particular case. But this is something that's not strictly limited to government. I mean,
Mhm.
whether at academic institutions, or people who work for a law firm, or other institutions that are also being targeted, to be told to not speak up and to fall in line.
Yeah.
Um, you know, or just individual citizens who, see their neighbors getting picked up by ICE, for example. It's it's no longer just a challenge of within government. This is an opportunity for everyone to kind of like see, the parable about the frog in the boiling water, and they feel fine as it gets slowly warmer, and it doesn't know when, they're going to die because they're in
Yeah.
boiling water. I've absolutely butchered that. But um but the point, I think, is the same, which is that when we all need to make the decision of, when is when is it no longer normal? When is it time that you need to stand up and speak out? And one thing that, again, I think that everybody always thinks that there's somebody else who's going to speak out. There's somebody else who knows more. There's somebody else who's more better positioned to do it. But the reality is, we all have our own agency, and we all have the responsibility to speak up and speak out when we see something that's not right.
Yeah,
Absolutely.
definitely. Well, thank you so much for spending this hour with us today. We really appreciate you coming to share your story.
Absolutely. Thank you, Nick, for your service to the nation. You just mentioned courage is contagious. You're an example of that. Thank you so much for bearing witness. We are grateful to you.
Thank you. And thanks so much for having me on the program.
Of
Absolutely.
course. All right, before everyone logs off, I do have a few quick announcements for the center. So we'd like to invite you to our next upcoming webinar on June 16th, featuring Dr. Stephanie Bushman, former New Jersey Commissioner for the Department of Community Affairs. She'll be joining us to explore insights on government systems that listen, understand, and respond to the needs of society. If you would like to stay connected with the Greenleaf Center, you can follow us on LinkedIn, Facebook, and Instagram, where we'll post all information about upcoming webinars and events. And lastly, if you could please take the Zoom survey that will pop up in your browser after the webinar ends, we would really appreciate that. So thank you all who logged on today, and we thank Nick for joining us. Take care.